This year, Bound Brook won its second NATA Safe School Sports Award, which is an award that highlights the safety precautions that schools take in order to keep their student athletes safe. We met all the criteria in order to be eligible for this award, and some of the things that we as a school do for our student athletes is, we do require all the student athletes to have pre-participation exams before coming in and playing sports, and also filling out health history updates in between each season. This helps us as healthcare professionals to see any risks involved, that student athletes might have before participating in sports. We also require all of our student athletes to do baseline concussion testing, and this is to help rule out concussions and to see how student athletes are performing when they do sustain a concussion. Here at Bound Brook High School, we have 2 athletic training facilities, and that's able to help me provide the best possible care for prehab services as well as rehab services for our student athletes, because we are so spread out among the community with our sports. My biggest goal for this year was to create a concrete rehab and prehab plans for our student athletes here. Some of the underprivileged athletes don't necessarily have the best access to healthcare, so to be able to provide rehab services for student athletes who can't necessarily go to physical therapy or to a doctor has been a big accomplishment of mine.
So Bound Brook's award of the NATA Safe School Sports for the second time is really a feather in their cap. It's really a testament to their commitment to the welfare of the students. It means they're paying attention, again, to pre-participation screenings. It means they're paying attention to the medical needs of the students, as well as sort of the psychological and social needs of those students. They're preparing for emergencies. They're formulating plans ahead of time. It's a very proactive approach, and it really shows their commitment to their craft. I think it's a nice award for them.
Well, here at Bound Brook High School, one of the backbones of our athletic program is having a qualified, certified athletic trainer to care for our athletes and their well-being on a daily basis. Having Jamie with us this year on her first year has been a godsend. I mean, she is extremely professional, extremely well-knowledged, and the way she perfectly fits in well here at Bound Brook High School with our athletes and the type of students that we have. Our kids are tough, they're hard-nosed, and Jamie fits that personality very well. I mean, she's very straight with the kids, she's very honest with them, but most importantly, she puts them on a program that's not only going to keep them safe, but it's going to prepare them, for the athletic contests and practices that they go through on a daily basis. As the athletic director, to have a trainer, basically, I don't have to micromanage her at all. I know she takes something and she runs with it, and she's very competent in what she does. And to have that relief of my mind, one less thing that I need to worry about, I'm truly blessed to have that in Jamie. She from the first time she got here, she just took the bull by the horn. She just started, made the room her own, made the facilities her own, got to know the kids, the coaches, communicated with everybody, and I'll put up her against any trainer in our conference and area for the care and services that she provides.
Every March we celebrate National Athletic Training Month. This year's theme is athletic trainers are essential to healthcare. My goal for National Athletic Training Month is to really show people what athletic trainers can do. A lot of people still don't know that what we're capable of, or might not know what we can possibly do for their child. And my goal is to build relationships with parents and athletes to really show why athletic trainers are absolutely necessary for safety in sports and also in healthcare.
In my opinion, athletic trainers are essential to healthcare because of their experience working with the athlete, their training, and their daily hands-on approach to being with students every day. Me as a family physician, I'm not at the school, I'm not with my athletes on a daily basis, but the trainers are. So they develop a much better rapport with them, they know them much closer, and their level of training, their experience in injury prevention and rehabilitation, in strengthening and protective equipment, is essential. They have a skill set that I don't have, so I rely on their expertise and their knowledge of the athletes, and together it makes for a great team, a great combination to help take care of our kids.
Working with RWJ has been an excellent relationship for me. When I got here almost 4 years ago, that was the partnership that we already had, that I inherited, and I'm very blessed and glad that we did. I've been working with Ryan since I got here, and he's always provided us with top-notch people, well-trained professional people, and to know that RWJ is going to provide that, again, it's just peace of mind, and makes our life as an athletic department much easier. And whether it's our full-time staff that we've had, or if they have to be out for whatever reason, any per diems we've had or any substitutes have always been of that same RWJ standard of professionalism, knowledge, and just being personable people here for the betterment of our athletes. So it's been a great relationship thus far, and I look forward to it, continuing in the future.